Chapter 5, Treatment of Unipolar Depression. In this chapter, we will examine the medications and other treatment considerations for clients with depression. Depression is the most common presenting concern in all treatment settings. Assessing the nature and type of depression is the key for suggesting proper medication. Clients who are depressed, only 30% of those will seek treatment, and less than 20% of those will seek treatment to take antidepressants. When we are looking at clients, we have to take into consideration, once we are doing our treatment planning, or actually even prior to treatment planning, when we are assessing and taking in information, if the depression is endogenous or exogenous. If the depression we believe is endogenous, we're looking at it from a biological base. So we're looking at perhaps it could be a depletion of one of the neurotransmitters or all. It could be a depletion of serotonin, norepinephrine, dopamine, or even all three. It could be a familial link in which it might run in the family, but we're looking at that it is a biological base. And of course, if we believe it's a biological base, the medication is a consideration. If it's exogenous, then we're looking at is there are outside forces that are influencing the depression, perhaps stress or grief. And these are things that could be influential in this client being depressed. In some cases, we might find that it's both internal and external factors that are playing a role in the client's depression. Depression can also be caused by physical disorders, anything from Alzheimer's to asthma, anemia. And there are an array of physical disorders in which you can look at on pages 24 and 25. Medications and other substances have also been known to cause or worsen a person's depression. So what's important is to take a medication inventory during your history and assessment of your client to determine perhaps if one of the side effects of a medication they are taking is depression. Psychotherapy and counseling are effective treatments when we have clients with depression. If a person isn't responding to therapy alone, then an antidepressant should be considered as part of the treatment, and a referral to a psychiatrist or their general practitioner should be made. Psychotherapy and medication together have been proven to be effective, and that is because if we are looking at it from a biological stance or an endogenous, that there are some neurotransmitters that there might be a depletion of it, or there might be a biological cause, the medication will stabilize that. However, the psychotherapy will provide that client with coping strategies to handle their symptoms, to manage their symptoms. Psychoeducating the patient on depression is also very important, the symptomology, to normalize it, as well as so that they are aware of the symptoms as well as treatment. There are procedural steps for clients on pages 32 to 34 in which you can review. Nearly every form of counseling has been shown to be helpful in treating a client with depression. However, the following are therapies that they have found to be most effective. For a brief or quicker solution to a client, suppose that they only have a certain amount of sessions, then solution-focused therapy is a brief and quicker way of addressing some of the client's symptoms and some of their issues. However, cognitive therapy and cognitive behavior therapy have also been shown to be effective. Before we start talking about medication, there's a few things that we need to take into consideration. In each chapter, as we discuss disorders, you will find tables, and in those tables you will find the various types of drugs. Drugs, they will be named with their trade name and generic name. The trade name is the commercial or brand name of the drug. So in advertisements, when you see Wellbutrin or Risperdal or Prozac, these are the brand names. It's equivalent to if we were to go shopping and you are wearing Old Navy jeans or Guess jeans. Those are brand names. The generic names are drugs marketed by its chemical name. So that's where you will find pretty much so drugs that you're not familiar with the name, but it's because it's based on its chemical compounds. So if we were to take that same example of the jeans we were to wear, jeans would be the generic name. However, the brand name would be whatever name that is on those jeans. The FDA black box warning is the most serious type of warning mandated by the FDA, and they are prominently featured in the labeling of drugs to warn prescribers about serious and adverse reactions or special problems. This is very important prior to the client deciding to take the medication so that they are aware of the possible side effects or adverse reactions, as well as to educate them that if they start experiencing certain side effects, certain reactions, that they know what to do and that they understand that it is a serious problem. There are four main categories of antidepressants: tricyclics or TCAs, selective serotonin reuptake inhibitors, SSRIs, monoamine oxidase inhibitors, and heterocyclics. Tricyclics or TCAs are the oldest antidepressant. The TCAs are not clean medications, and therefore they might affect many non-targeted organs and systems in the body. The TCAs prevent the reuptake of neurotransmitter substances back into the presynaptic cell. TCAs are also anticholinergic, which means it blocks the binding of acetylcholine to its receptors. Some side effects are sedation, weight gain, difficulty relaxing, dizziness, etc. It's not safe for children or the elderly and pose a serious risk of overdose for clients with significant suicide ideations. You will see a list of tricyclics on Table 5.1. Second-generation TCAs, such as trazodone, affects the serotonin by acting as a 5-HT2 receptor antagonist, which is pretty much in layman terms a serotonin receptor antagonist. The newer second-generation TCAs have fewer side effects than the older TCAs, and the common side effect is sedation and dry mouth. It also poses a less suicide risk. Selective serotonin reuptake inhibitors, or SSRIs, block the reuptake of serotonin back into the presynaptic. Blocking the action allows more serotonin to exert its influence on the postsynaptic cell. Side effects could include headache, nausea, diarrhea, dry mouth, anorexia, weight gain, etc. SSRIs for children and seniors and patients who may be at risk of suicide. It is also important to note that SSRIs are cleaner and are able to act with other medications. Serotonin syndrome. Serotonin levels can become too high in a person and they may experience agitation, confusion, and insomnia, amongst other symptoms. When this happens, this is called serotonin syndrome. SSRIs or other medications can cause serotonin syndrome and cause the levels of serotonin to rise within the central nervous system. On Table 5.2, please look at the selective serotonin reuptake inhibitor table. Monoamine oxidase inhibitors, or MAOIs. MAO is an enzyme that breaks down neurotransmitters, which makes them ineffective. The drug MAOI, which inhibits the MAO, stops the enzyme from breaking down the neurotransmitters, which allows them to still be effective. MAOIs have similar side effects to TCAs. However, clients have dietary restrictions if they are on MAOIs. They must stay away from certain foods that have tyramine in it. Please refer to Table 5.4 for MAOIs. Other antidepressants, heterocyclics, have similar side effects to SSRIs. There are some heterocyclics such as SNRIs or serotonin norepinephrine reuptake inhibitors, that are prescribed for general depression, generalized anxiety, postpartum depression, and also may increase blood pressure at higher doses. Lithium can also be used for more difficult and treatment-resistant cases of depression. There is a heterocyclic antidepressant table you can review on 5.3. Herbal and holistic substances. St. John's wort is a plant that is said to have medicinal properties. It is believed that St. John's wort can help control mild to moderate levels of depression with virtually no side effects. Ginkgo biloba is a tree of Chinese origin, and the extract from it is believed to relieve mild depression and increase memory and concentration. Dehydroepiandrosterone, or DHEA, is normally secreted in the adrenal gland and is a precursor to testosterone and estrogen. Adolescents have high levels of this substance, but the levels decrease in age. So it is believed that giving DHEA orally may reduce mild to moderate depression. However, it causes weight loss, increases large muscle mass, and may increase sexual appetite. S-adenosyl L-methionine, or SAMe, is a substance that is endogenous to our body. However, we do, based on the foods we eat, convert the food into SAMe. Patients with poor diets typically make less SAMe. A synthesized substance has been shown to be effective in many prescriptions of antidepressants for relieving depression. Light therapy for seasonal affective disorder has been shown to also be effective in treating SAD. So purchasing box is effective for individuals who are suffering from SAD. Exercise has also been shown to be effective. Besides it increasing motivation, it helps release endorphins and neuromodulators. And finally, electroconvulsive therapy, ECT. Clients with severe depression that do not respond to antidepressants, if their depression worsens and includes suicide ideation, they may be referred to ECT.